I'm Himanshu Borse. I work as a gynecologist, obstetrician, and IVF specialist in the UK. Welcome to our YouTube channel. I hope you're all well. You must have heard about our recent launch of a comprehensive women's health app called Nari. It is available in India on Android, and soon it will be also available for iPhone. And we are hoping in next couple of months it will be available globally. Today I'm going to talk about women's health issues according to their age. According to the World Bank, women's population in India is just shy of 500 million, which is a huge number, and it's a huge population to care for. Women's health issues, they are quite wide range, and my favorite dictum is healthy woman, healthy nation. And research has proven that the countries who have which have focused on women's health, they have grown exponentially. And our main issues at the moment in India, as well as quite a few other countries, is lack of awareness and education regarding women's health issues. We all know that there has been an increase in use of social media as well as WhatsApp, and my worry is that there is an increased risk in following unauthorized information on health. Majority of the times this information is not helpful, but in certain situations it could prove quite risky to one's health. Obviously, there are issues of gender discrimination and lack of health facilities adding to the insult. So, between age 10 to 19 years, this is we call adolescence and early teenage years. And the main issues in this age group are menstrual issues, which could be lack of menstruation before the from the average age of menstruation in that country, which is actually coming down globally. In India, it's still around 13 years of age. In the UK, it is around 10 and a half years. And the issues could be no periods by age 13, or irregular periods, or heavy periods, painful periods, and obviously the symptoms related to the periods, which can lead to conditions like premenstrual syndrome. Nutrition has been a major issue, but I'm glad to see that to a certain extent this is improving, although it hasn't improved to an extent we would prefer it to be. So 70% of Indian women have their hemoglobin below average, and simple treatments such as iron supplements or consuming iron rich food will counter this problem. Obviously, there are some issues with lack of access to basic health care, which leads to poor overall health, and that complicates the issues in later age. There is a lack of education as well as awareness about sexual and reproductive health, resulting in high rates of sexually transmitted infections and teenage pregnancy. And obviously, sex is still a very taboo subject in India as well as other countries, and because there is no one willing to speak about it openly, there is going to be lots of issues in girls learning about their own bodies, about their own sexual health, and obviously the lack of sources uh, to counter the issues will add to the insult. In India, as well as in some other countries, early marriage is still a norm, which then can lead to an early pregnancy when a girl or a young woman is not physically, mentally prepared to get pregnant, which leads to high risk pregnancy, leading to complications during pregnancy as well as childbirth, and in worst cases can lead to maternal mortality. There are social stigmas and gender discrimination leading to limited opportunities and access to education, employment, and decision making power amongst the women of this age group. And we hope that by improving the education about these issues, we will be able to help um, significant proportion of these demographic. Between age 20 to 44 years, the issues could be lack of preparation for pregnancy. As I mentioned earlier, that a woman has to be mentally as well as physically be ready to get pregnant so that the pregnancy remains uneventful, leading to a delivery of a healthy baby, and most importantly, the mother staying healthy after the delivery. Infertility, obviously, in olden days when everybody was getting married by the age of 20 to 25, uh, probably infertility was not that bigger an issue. But now women are getting pregnant at a later age, and that can complicate the issue. Asian women are known to have low reserve compared to their Caucasian counterparts, and leaving longer to get pregnant complicates the problem. And currently, 1 in 7 couples suffer from infertility. Obviously, the infertility consists of male as well as female factors. So it is unfair to think of it only as a women's health issue. There is still a massive problem with unsafe abortions and lack of access to family planning services, leading to unintended pregnancies and maternal mortality. Malnutrition and anemia, risking the health of both mother as well as child during pregnancy and during childbirth, and potentially afterwards as well. There are urogynecological issues at this age, which means the women who had traumatic deliveries or multiple deliveries will have issues with their pelvic floor and can suffer from issues such as prolapse and urinary incontinence. At this age, there is an increasing problem of gender based violence, including domestic violence and sexual assault, leading to physical and mental health issues, which again increases the problem for women. You're all aware of cervical cancer, which is the second most common cancer among women in India, mainly affecting women in their reproductive age group. And the education about proper screening will definitely help to curb the problem. We are, we are aware that there is a vaccine available against cervical cancer. So if that is given to younger women, we can start protecting them from a younger age. In women 45 years and over, there are issues with menopause, such as hot flashes, mood swings, and increased risk of osteoporosis and heart disease. At this age, in quite a few places, there is a limited access to healthcare and lack of education about menopause, leading to underdiagnosis and undertreatment of menopausal symptoms. Lots of times, women just assume that they have to suffer because of menopause, but unfortunately, that is not the case. And these symptoms can worsen with time and have widespread impact on their overall health. Elderly abuse and neglect, as women are often financially dependent and vulnerable during this stage of life, and that is still, unfortunately, a massive issue in India as well as some other countries. There is a lack of social support and isolation, leading to depression and other mental health issues. So you can see that it is not just about physical health, but also about the mental health. 60 years and above, in this group, women will develop chronic non-communicable diseases such as diabetes, hypertension, and cardiovascular diseases, leading to increased healthcare costs and reduced quality of life. Limited access to healthcare as well as financial and physical barriers, leading to late diagnosis and poor management of health conditions, which affects their quality of life. Neglect and abuse, with elderly women being more susceptible to physical, emotional, and financial abuse, is a major issue. Obviously, cancer remains there at that age as a risk, and increasing rates of mental health issues such as dementia and depression due to isolation, loss of loved ones, and social stigma towards mental health in older women. So, as you can see, that in various age groups, women do suffer from different conditions, and our aim with Nari app is to bridge this gap and make women more aware of their own body, of their own health, take control of managing their own health, provide them enough support. And that's why our app allows you to tracking of symptoms. So whether you are a menstruating woman or a menopausal woman, you can still track your symptoms, and that gives you a graphical representation of symptoms. So whenever you visit a clinician, that will help them to reach the diagnosis sooner and offer you the appropriate treatments. On this app, you can store your investigations, scans, as well as other reports. It has got AI incorporated in it, so it will flag up any warning signs in your health, which will allow you to seek help in a timely manner. There are videos embedded in it which provide you with evidence based information as well as education, and we will keep updating them on a regular basis. And it also works as a one place for all of your health records, so you don't have to carry hard copies everywhere, and it's available on Google Store. Our main aim is primary prevention, so we want you to take control of your health, get educated, learn more about your own body, identify warning signs, and seek specialist help wherever needed. Thank you.